All right, get ready because today we're taking a deep dive into something that sounds, well, a little intense. Fluid overload.
Intense is a good word for it.
You've sent over some really interesting articles on this, and honestly, I'm kind of fascinated already. It's more than just, feeling a little bloated, right?
You could say that. We're talking about this whole complex interaction. Too much fluid in the body, problems, getting rid of it, and then on top of that, that fluid going where it shouldn't be.
Okay, so like a plumbing nightmare, but inside your body.
That's a good way to put it.
So plumbing issues aside, why should this matter to someone listening? What makes fluid overload something to actually be concerned about?
Well, it's a silent problem, often hiding behind more serious conditions like heart failure. You might not even know it's happening until it's already causing real problems. Actually, one of the studies you shared really highlighted that. It found that for ICU patients holding on to more fluid during their stay, it significantly increased their risk of dying.
Wow, okay, that's pretty serious. Clearly not something to ignore then, which kind of leads us to the next logical question. How do doctors even detect this sort of stealthy condition? It's not like there's a fluid overload alarm that goes off, right?
Not quite. Though there are these things called biomarkers, basically, telltale signs in the blood that can give us some clues,
Okay.
like natriuretic peptides. Elevated levels can be a red flag, signaling a potential problem. But it's not a perfect system. Someone with kidney problems could have high levels for totally different reasons.
So it's kind of like a smoke detector that could be set off by burnt toast just as easily as an actual fire.
Exactly.
You have to really investigate further to know what's going on.
Yeah.
What are some of the other, detectives in this medical mystery?
Let's see. Well, there's lactate. High levels of lactate usually mean the body's tissues aren't getting enough oxygen,
Right.
which you'd think would go hand in hand with fluid overload, right?
Yeah.
But it's complicated. That's not always the case. And you've got this interesting one, CA1235. Now, most people associate that with ovarian cancer, but researchers are actually looking into its potential link to congestion in heart failure patients, specifically how it relates to fluid overload.
So we've got these clues from the blood, but what about actually getting a visual? Can doctors actually see fluid overload?
They can, and this is where ultrasound technology comes in. Okay. It allows for real-time imaging without using any radiation, which makes it incredibly useful. Think of it like sonar, but for your insides.
Sign me up. So what can doctors actually see with these internal snapshots?
A lot, actually. There's focused cardiac ultrasound, or FOCUS.
Catchy?
Yeah, it's basically a quick scan of the heart. It can show the size of the chambers, whether there's any fluid around the heart itself, and even give you an idea of how well the heart is pumping.
So it's like a status update on how the heart's handling the workload.
Exactly.
What about the rest of the body? Can ultrasound see if there's trouble brewing in other organs?
Absolutely. There's IVC ultrasound, which looks at a major vein to figure out the pressure on the right side of the heart. But one of the most amazing techniques is venous excess ultrasound, or VXUS.
VXUS. Sounds kind of intense.
It is. VXUS looks at blood flow in specific veins to see if there's congestion in organs, like the liver or kidneys. Imagine looking at a traffic map of the body. VXUS helps you pinpoint those congested areas, the traffic jams, that tell you an organ's in trouble.
It's like Waze, but for your internal organs, pinpointing those problem spots. That's amazing. What about the lungs? Can't forget about those. They're pretty important for this whole breathing thing.
You're right. And the great thing is, ultrasound can even see fluid in the lungs. It's called lung POCUS. It's especially helpful when someone's having trouble breathing because it can tell us whether it's the heart that's the problem or something else going on.
Wow, it's incredible how advanced these imaging techniques have become.
Mm.
So we've got blood tests that offer clues and ultrasounds giving us this look inside the body, but that's a lot of information. Or is there one single test that definitively diagnoses fluid overload, or is it more like this puzzle that needs to be pieced together?
It's definitely a detective story. It's really about putting all the clues together from different tests and the patient's overall situation, It's not like one size fits all.
So like a medical jigsaw puzzle. Speaking of putting the pieces together, let's talk about treatment. Once fluid overload's diagnosed, what can be done? You mentioned diuretics earlier, those classic water pills. Are those kind of a go-to for treatment?
They're definitely important, especially when the heart's having trouble keeping up. Basically, diuretics tell your kidneys to get rid of more water and salt, so you produce more urine and get rid of that extra fluid.
Okay.
It's like adjusting the pressure valve on a dam to control how much water flows out.
Instead of a plumbing nightmare, it's more like controlled drainage. but I'm guessing it's not quite as easy as just popping a pill.
Right. You've got different diuretics that work on different parts of the kidneys, so finding the right one or even combining a few really depends on the patient's specific condition. Like, you've got spironolactone, which blocks a hormone that tells the kidneys to hold on to salt, and then there's furosemide, which acts more directly on the kidney's filtering system.
Wow.
It's really about fine-tuning the body's fluid balance.
It's amazing how those medications can be so specific, targeting those exact mechanisms. What about when diuretics just aren't enough? The articles mention some other procedures for more severe fluid buildup, like large volume paracentesis.
Yeah, large volume paracentesis, or LVP for short, is kind of like a pressure relief valve for the abdomen.
Right.
It's used when there's so much fluid, we call that ascites, that it's actually pushing on the internal organs. They basically insert a needle and drain the fluid out directly.
That sounds kind of intense, but I imagine in those situations it brings much needed relief.
Absolutely, and oftentimes they'll give albumin infusions afterwards.
Albumin, that's that protein that acts like a fluid magnet, keeping things where they should be, right?
Right. Exactly, to keep the blood volume up and prevent any complications. Now, another procedure, the TPES procedure, is an option for people dealing with portal hypertension. That's where you get this buildup of pressure in the blood vessels of the liver. This procedure creates kind of a detour, a shunt, to redirect the blood flow and lower the pressure, which helps with the fluid buildup as well.
So, like rerouting traffic to avoid a jam. And then, of course, in extreme cases, there's always the possibility of a liver transplant.
Right. For those who are eligible, a transplant can be a lifesaver.
Wow, that's quite a range of treatment options. Let's shift gears a little and talk about something specific mentioned in the articles, fluid overload in people with cirrhosis. It seems like this condition can really throw a wrench in things.
Oh, absolutely. Cirrhosis, with the scarring of the liver, it can really mess with the organ's ability to manage fluid properly. You can get the same abdominal ascites we talked about, but it can also show up as hepatic hydrothorax.
Hepatic hydrothorax, it sounds serious.
It basically means fluid building up around the lungs, which obviously makes it hard to breathe. Imagine trying to inflate a balloon inside a water-filled container. That's what the lungs are dealing with.
So, like ascites, but in the chest cavity. That sounds awful.
It can be really uncomfortable, and it needs to be addressed quickly. Managing the underlying cirrhosis is key, and diuretics often come into play, but sometimes you need more invasive procedures to actually remove the excess fluid, something like a thoracentesis.
Thoracentesis, how are they?
Exactly. It's basically using a needle to drain the fluid from around the lungs, similar to how paracentesis works for the abdomen.
The human body is such a fascinating mix of resilience and fragility at the same time. We've covered quite a few procedures for managing fluid overload, but are there times when these options just aren't suitable, or maybe they haven't worked? What happens then?
That's when things get really interesting. You see, for some patients with cirrhosis who just keep getting this fluid buildup around the lungs, we might consider something called pleurodesis.
Okay, pleurodesis. That sounds kind of complicated. What is that?
So basically, we inject a substance between the lung and the chest wall, and it irritates the lining.
Uh-huh.
That irritation causes inflammation, and as it heals, it actually creates a kind of seal. So then fluid can't build up there anymore.
So it's like hitting the reset button on that space, making it heal in a way that prevents that fluid buildup from coming back.
Wow, that's wild. Okay, let's move away from these more intense procedures for a second. What about lifestyle changes? Can people actually do anything themselves to manage fluid overload?
Oh, absolutely. Lifestyle changes are so important, especially when it comes to managing this long term. Think of it this way. Procedures, they deal with the immediate problem, but lifestyle changes, they're all about stopping that problem from happening again in the first place.
So it's about giving people the tools to really take control of their health.
Exactly. And it usually starts with something as basic as what you eat. Cutting down on sodium is huge for anyone who tends to retain water.
Yeah, easier said than done, though, right? I mean, with all the processed foods and eating out these days. It definitely takes effort, for sure. You've got to make reading those food labels a habit and try to cook at home more often.
It's about taking back control of what's going into your body. You know what? I've actually found that even just making small swaps, like using herbs and spices instead of salt, it really adds a lot of flavor without all that extra sodium. Any other diet tips?
Well, this might seem a little counterintuitive, but while staying hydrated is super important, drinking too much can actually make fluid retention worse.
Oh, wow.
It's all about finding that balance, you know? You want to be properly hydrated, but not overdo it. Your doctor can help you figure out what that means for you specifically.
So it really is all about balance, just like with so many things in health. And I imagine maintaining a healthy weight plays a role here too.
100%. Carrying extra weight, especially around the middle, it puts more strain on the heart and blood vessels, which makes it harder for the body to manage fluid properly.
Right.
Even losing a small amount of weight can make a difference.
It's amazing how interconnected everything is. One of the articles also touched on the importance of specialized follow-up care for people with cirrhosis and fluid overload. Can you elaborate on that a little?
Yeah, sure. So that study found that when patients had a dedicated cirrhosis nurse as part of their aftercare plan, they did so much better.
Oh, interesting.
These nurses are like a main point of contact, helping patients navigate everything: medications, diet changes, lifestyle modifications. It can be overwhelming.
So they're like a personal health coach, someone to guide and support you through the entire process.
That's it. They're there to answer questions, provide encouragement, and make sure patients stay on track with their health goals. And get this, the study actually found that this type of dedicated support, it led to fewer hospital readmissions and even better survival rates.
Wow, that's incredible. It really goes to show how important that personalized care and support are. Well, we've certainly covered a lot today, from the science behind fluid overload to all the different ways it's diagnosed and treated and how to manage it long term. I feel like I need to go drink some water now and maybe schedule a checkup.
Well, as we always say, knowledge is power. When we understand these things, even something as seemingly simple as water retention, it helps us take better care of ourselves.
That's a great point. And on that note, we've reached the end of our deep dive into the world of fluid overload. It's been fascinating, complex, but definitely fascinating. We hope you found it insightful, and until next time, stay curious, stay informed, take care of yourselves.